Occasionally I'm accused of only bringing bad news to the table, so I thought tonight that I would start this presentation by letting you know I've got some good news and we've got some statistics, and I'm happy to share those tonight in our COVID-19 report. It's amazing to me that tomorrow, as of tomorrow, we'll have been in school a month already. That's a while. That's my first stat that should blow you away. A month of school. And the district has managed, to this point, fairly well, COVID-19 pandemic and the Delta variant. I want to go back to our primary goal. The opening task force that met over the summer multiple times determined that our goal coming into this year would be to prioritize and protect in-person learning. We want to do that in a safe way, but we need kids to be in school. Many of us are parents up here, including myself, and last year having kids not in school, not in sports, not in music, not in the things that they love was difficult, and it made for a tough year. So the main goal was to prioritize in-person learning. We were given a great tool by the St. Louis County Public Health Department, which is modified quarantine. Modified quarantine allows students to stay in school even when someone in their classroom is positive for COVID, as long as the district implements universal masking and that students are asymptomatic. And so this has been a big shift for us. Last year, if we had a positive case in a classroom, we closed that classroom, whether students were sick or not. And so we sent a lot of healthy kids home as a mitigation strategy, and that was the rule. This year with modified quarantine, we've been able to take a different approach, and it's helped us keep students in school, healthy students in school. So right now, as we sit here today, there are 83 students in grades K through 12 that if we were using full quarantine from last year, 83 students would be home right now. Those students are in school. So that's the headline really of this slide. The modified quarantine is keeping kids in school. The only way that students are eligible for modified quarantine is if the school has universal masking and has other mitigation strategies in place, which we do. We've had some limited cases of transmission. I'm going to show a slide in just a moment that will give some data. The data doesn't take into account this week, so there will be a little bit of a lag, maybe from what you see on the website on the website tracking. But we've had limited cases, and we've had very limited transmission within the schools, and that is because students and staff are staying home when they're sick or they're symptomatic, and that's really a great key. Also, universal masking and other mitigation strategies. I would say that we understand that wearing masks is uncomfortable. I'm uncomfortable right now, sitting here wearing this and talking to you. It's inconvenient. All of us want to get to a time where we don't wear masks in our jobs. We don't send our children to school. I have two girls that tell me all the time that they don't like wearing masks. So I don't know if they're campaigning or just complaining, but it's worth it to keep them in school. And so we hope for a time when we can get rid of these masks, when they can be optional. We look at the data every day. There was a time back in June where we had a mask optional scenario, but the data that we look at every day and the guidance from CDC and other health organizations has changed tremendously due to the rise in Delta variant cases. Delta variant impacts children. You've probably seen on the news, there was news this morning about a neighboring school district that's really suffering from in-school transmission of the Delta variant of COVID-19. We don't have a magic number or a metric that we would look at to say when we get to this place, the decision will be made to take masks off and make them optional in school. However, we're going to watch the data, and we're going to watch our own transmission rates. And when levels get to a point, such as the super low levels of May and June, a conversation certainly will be had. I think the district has shown a great ability to pivot and phase things in and phase things out as the reality on the ground changes, and that's a strength of Lindbergh, and last year is evidence of that as we moved in different ways and did things based on science and data and our own situation that we study here. If we could go to the next slide, I do have some data to share with you. Again, this is somewhat dated, but it's worth looking at. School contacts means that students were in school with COVID and they were contagious, and that has been limited to this point in the school year. We've got quite a few students. As you'll see, there are 31 students, positive cases without school contacts, and that simply means, as of this report, that those students had it in the summer and didn't start school with us. They were either positive or they were finishing isolation. At this point, 3 staff members positive, which is an incredible number. 85% of our staff is reported as vaccinated, which is an incredible number. We figure that's a little bit low. Some people don't like to fill out our surveys. We do this voluntarily. We don't mandate reporting, so we just ask people, we beg and plead for people to let us know if they are. And 85% is a strong number. We're proud of that number. We think it's probably higher than that. Obviously, 100 is where we would like to be. But as a staff, we're very well protected. The quarantine data, you can see 57 students as of this report were under modified quarantine, which means they get to come to school every day. They're just asked to follow quarantine guidance when they're at home and in the community. And we have had 106 students out of school. Again, that's based on things that happened in the summer or exposures, during the weekend, but that's not the district putting these kids into quarantine. This is pediatricians or the county health department. So that's the data. It will change. We're only a month into the school year, but it's good news to this point. The masking, I know, is a hot topic and it can be debated, but the fact is, if we want to access modifying quarantine, keep these 83 kids in school instead of sending them home in a healthy situation, we have to do this. As much as I know the people at this table don't like having these on right now, I know the kids don't, but we need our kids to be in school, and we established that as a priority earlier in the summer when we had our task force. So